So welcome to the part 2 of the facial nerve injury chapter. In part 1, you have learned how to take a good history and do a clinical examination and make a diagnosis for a patient presenting with facial nerve palsy. In part 2, the learning objectives are two. First, to understand the surgical management of the facial nerve palsy. The second is to make a decision about to choose a surgical option for a specific region of the face. So let us see in the part 2 about the management and the surgical decision. Remember that in part 1 we have already discussed about how to make a provisional diagnosis in a case of facial nerve injury depending upon the detailed history and a clinical evaluation. In this part 2 we will learn what investigations are supposed to be ordered in a patient with facial nerve injury and what is the management and how to plan it. So the question after the diagnosis is, what are the investigations which you will perform in a case of facial nerve palsy and why? And your answer should be you will be performing some electrophysiological studies, and they are done to assess not only the extent of nerve disruption but also to predict the outcome and to plan the treatment options. The electrodiagnostic test will include the routine EMG and the NCS. One specialized type of electrodiagnostic study is electroneuronography of facial nerve. So the difference between NCS and electroneuronography is that NCS basically evaluates the motor and sensory function, and electroneuronography strictly evaluates the motor axons. So it records the evoked compound action potential and it also quantifies the degeneration of the nerve fibers. So it will help you in determining the time and the need of the surgical intervention. Since it quantifies the motor action potential, if there is, say for example, a defunction of 90%, that it means there is poor prognosis if there is no surgical intervention. In cases where intracranial or intratemporal facial nerve palsy is suspected, you can go for a CT scan and MRI of the brain. Also, your investigation must be tailored to determine the anatomical site of the lesion. So, there will be certain clinical tests like salivary flow test, Schirmer's test, stapedial reflex, and taste examination. Now, the next question which may be asked to you will be, what will be your goals of treatment? So, the goals of treatment will be pertaining to each of the specific part which is involved in facial nerve palsy. Like goals for treatment for eye, you have to protect and maintain the vision, to maintain the eyelids function, and to develop the animation of the eyelid so that patient is able to express emotion. The goals of treatment for mouth will include towards achieving symmetry, oral continence, achieving good coherent speech, and to provide the patient with a balanced smile which he can use socially. Then the question comes that what are the non-surgical measures for the immediate protection of eyes if there is exposure of eyeballs and there is Bell's reflex present. So you must remember one by one. First is the use of artificial tears 3 to 4 times a day. During night, eye ointment, lid taping, and eye patches when the patient is sleeping. If there is only a weak eye closure, then the patient should be taught forced blinking exercises. And sometimes the exposure is so severe that there is a risk of exposure keratitis, then you must go for temporary tarsography. But remember that all these steps of non-surgical measures will be towards protecting the eyes while you are preparing the patient for surgery. So the question comes, what are the options for surgery, especially in cases of immediate and early nerve injury? So the first option will be, if possible, direct to end repair of the damaged nerve, especially in cases of parotid surgery or a surgery over temporomandibular joint.
There can be a nerve grafting option, especially where there is a wide neural gap. So, if you encounter a neurofibroma or a lipoma of the face, and while excising, you have to excise a part of the facial nerve also, you can immediately do the nerve repair via the grafting. So, in the pictures, you can see how a interposition nerve graft looks like. You can also go for a cross facial nerve graft in the immediate management only. So, if there is an unavailable proximal stump or the distal stump is lost, then you cannot use the same side facial nerve. So, you have to go to the other side. What you will do is that it is a two-stage procedure in which the first stage you will place the cross facial nerve graft, and after 9 to 12 months, when the nerve graft is coapted to the branches of the affected facial nerve, you can either coapt it to the branches of the affected facial nerve, or you can directly neurotize to the target facial muscle. Nerve transfer procedure is also indicated in facial nerve palsy, like the masseteric nerve transfer or the hypoglossal nerve transfers. And these are done when there is unavailable proximal stump, but the distal nerve is intact. The motor end plates of the muscles are intact, and you cannot use the contralateral facial nerve as donor, and you cannot go for cross facial nerve grafting. Sometimes, if there is no stump available at all, then you can directly neurotize into the target muscle. Then, what are the specific surgical options for the reasons of the face? So, I will just enumerate it. You can read in details into the textbooks from the textbooks. So, just remember the name of the procedure for a particular region. For brow, if there is drooping of brow, so you can go for a direct brow lift, you can have a coronal brow lift, and you can have an endoscopic brow lift. If there is a lagophthalmus in the upper eyelid, the most commonly used is the gold weight. Temporalis muscle transfer is also used, or a spring or a trausorrhaphy procedure may be done. In cases of ectropion of lower eyelid, the best is the tendon sling. Make a tendon sling with the temporalis muscle transfer. You can go for a lateral canthoplasty. Horizontal lid shortening can also be done. With problems of the nasal airway may be addressed using a static sling or a septoplasty. For bringing the symmetrical smile and taking care of the commissure and the upper lip, you can go for a micro neurovascular muscle transfer using a part of gracilis with the ipsilateral seventh nerve or a cross-facial nerve graft. You can go for a temporalis and a masseter muscle transfer also. Some static slings are also used, and some soft tissue balancing procedures like rhytidectomy, mucosal excision, or advancements are also used to bring a symmetrical smile. Then for the lower lip, you might have to go for selective myectomy of depressor labii inferioris of the normal side. Otherwise, there is ectropion of the lower lip. Muscle transfer of plasma and platysma and digastric may also be used. So these I have just written down the name of the procedure that catering to a specific reason. And there will be some procedures which are commonly performed, which you have to read in detail. And then once you have answered these questions, there may be other questions if you have, if the examiner have time, like the assessment of the level of the facial nerve injury. Then the clinical test, which I was mentioning to you regarding the assessment of face sensation, the dryness and watering. Why does it happen? What is the functional importance of the lower eyelid? A very commonly asked question. Then about the course of the facial nerve, the names of the muscles of the facial expression, and also about the branches of the facial nerve. So in our part 3 of facial nerve palsy chapter, we will discuss these important questions. Thank you so far. and happy reading.